My highlight of 2024 was that at each of the CAB meetings, we had really, I thought, integritous CAB members that shared their stories of who they were and what they'd like to see themselves. And so I really feel as though if we could keep that momentum going into 2025 and beyond, it would keep us always having collaborative partners as a part of the work that we've been doing in community as well as with each other.
I'd say the highlight of 2024 for me was the joint event we had with the Baltimore Museum of Art, where we had the opportunity to honor community health workers who live and or work in Baltimore City. It was part of a collaboration between the Center for Health Equity and Miss LaToya Ruby Frazier, who's a photographer. And that event really highlighted the importance of community health workers, their uniqueness, and just really gave the audience an opportunity to come to understand the role that community health workers play in advancing health equity and the leaders that they are in the communities that they support and live in.
I think one of the highlights that sticks out the most for me in my career with the National Kidney Foundation was that as part of a national collective impact strategy, the local market for Maryland and Washington, D.C., stakeholders were implementing a roadmap to drive a cultural shift in primary care, toward increasing early diagnosis and appropriate management of chronic kidney disease, particularly in communities that were disproportionately burdened by chronic kidney disease.
I think of two things that really were highlights. One of them being our in-person meetings. As you know, we meet over at the School of Nursing every second Tuesday of the month. And one of the things I found is that in those meetings, not only were we getting very valuable information, but it gave us an opportunity as a community-based organization and working as a community-based organization to meet others who are doing that similar work and to really kind of share and exchange ideas in that setting. So that was one highlight. The second highlight was the jam sessions. And I found those to be truly informative from in a way that it's actually it was kind of innovative to be able to see community members and researchers really kind of exchanging ideas, but more importantly, the kind of co-learning that took place in that setting. And I think back to a couple of the sessions that I heard, and I think one of them that I remember was community partnerships, and really how I think academia continues to think about how they build these partnerships, but more importantly, I think some of the struggles and some of the barriers they try to overcome.
My highlight of 2024, personally, and also professionally, I am the co-author of a book. It's a personal development book, which is going to be released on December 24 of this year, December 7 and 8. And also, it was seeing the impact of CAB projects. One of them is Healthy for Two. They work with pregnant women and help them to make better choices for their health.
like to see for the CAB is that we're actually having a media event that actually engages the community to know who we are, what we're doing, and how they might be able to engage.
My New Year's resolution for the CAB is for all of the CAB members to continue growing in their relationships with each other. And I'd also really love to see more patients who struggle with some of the chronic conditions that the center does its research on as part of the CAB, and really leading the charge to ensure that our work continues to be patient-centered and community-grounded, and really uplifting people's lived experiences and the impact that those lived experiences have on the research and training that the center undertakes.
You know, looking at this particular project that I was just referencing, you know, looking at a collective impact process where the CAB is working with the community partners, you know, the stakeholders and such that are working with you, you know, day over day, month over month, over the year, that we're using a, you know, multi-phase stakeholder engagement process, and that we're looking at ways in which we can create those conditions for that collective impact, and really taking a stance of, again, holistically looking at patients first, and from mental health to kidney health to heart health, whatever the situation may be, but really looking how we can cross those boundaries and work more together.
You know, the first thing is that, you know, a lot of times we as I sit in these sessions, I think about it, a lot of times we leave out our youth. And what I'm hoping that we'll be able to do, especially those rising high schoolers, is to really kind of engage them in the conversation in this community. The second thing is that I would hope that we will look at is how do we engage the rural populations in Maryland. And the last thing I will say is this, is that what I would hope that we will do, and I think the Center for Health Equity is really a big proponent of this and is trying to do that, is really if we get into the implementation. We always do this research and we know that we have some best practices, but a lot of times we don't spend time on the implementation of some of these best practices in the community, so to sustain our communities and sustain our community-based organizations. So that'll end there, but those are the three things that I would like to see us, you know, kind of focus in on in 2025.
So my New Year's resolution for CAB is to keep listening to the community and create programs that meet their needs and make sure that our work brings positive changes.
Happy holidays, everyone. I'd like to thank each of you for all you do to make our work impactful and successful. In 2025, I hope we'll continue to build relationships among ourselves, with the communities we serve and represent, and with other groups that are working to advance health equity. I also hope we'll strengthen our capacity to share the results of the center's research with our communities, and that we'll grow in our ability to advocate with policymakers and other decision makers, holding them accountable for creating practices and policies that will promote a more just society.